This project is supported by the Administration for Community Living, ACL, U.S. Department of Health and Human Services, HHS, as part of a financial assistance award with 100% funding by the agencies. The contents are those of the authors and do not necessarily represent the official views of, nor an endorsement by, ACL, HHS, or the U.S. government.
Hello and welcome to Ask SMP. I'm Dunay, your community outreach specialist in Mississippi.
And I'm Johnetta, complex issues specialist for Senior Medicare Patrol in Georgia, Louisiana, Mississippi, and Vermont.
Each episode, we take a question from a beneficiary and break it down so you can learn how to protect, detect, and report Medicare fraud, errors, and abuse.
This episode's question comes from Gladys. She writes,
I see my primary care doctor only as needed. I have diabetes and high blood pressure, but have been stable on my medications. I usually see a nurse practitioner for labs and prescription refills. A new nurse practitioner suggested I might need some help at home since I no longer drive. Now I have an aide who comes twice a week. On her first visit, she asked me to sign a form for her agency. Later, I was shocked to see my Medicare summary notice showing that I was receiving physical and occupational therapy 3 times a week, even though I never had those services. I don't even know the agency that billed Medicare.
That's a powerful story, and unfortunately, it's a situation we see too often. Gladys thought she was signing a simple consent form for her aide, but in reality, the agency used it to bill Medicare for services she never received.
Exactly. And here's the key. Medicare does not pay for custodial help. Things like housekeeping, grocery shopping, or running errands. Those are considered personal care services, not medical care.
So what does Medicare actually cover when it comes to home health? Parts A and B cover intermittent or short-term home health services, but only under strict conditions.
Right. For Medicare to pay, your doctor must determine that home health is medically necessary. That usually means you need skilled services in your home, such as part-time or intermittent skilled nursing care, hands-on personal care from a nurse's aide, rehabilitation services like speech therapy, physical therapy, or occupational therapy, medical social services. And there are additional conditions. Your doctor must certify that you are homebound, meaning you can't leave your home without help. Your condition should be expected to improve in a reasonable period of time, or you need skilled therapy to maintain your current health and prevent further decline.
So, in Gladys's case, what she really received was help around the house, custodial care, but the agency billed Medicare as if she were receiving skilled therapy. That is home health fraud, billing Medicare for services that were either not provided or not medically necessary.
Now let's talk about hospice care, because fraud can happen there too. Hospice is a special benefit under Medicare. It provides support for people who are terminally ill, meaning they are not expected to live more than 6 months.
To qualify, 2 things must happen. A physician has to certify that the patient is terminally ill. The patient must agree to receive palliative care, comfort care, instead of curative treatment. Hospice is meant to be compassionate care that looks at the whole person, medical, physical, emotional, and spiritual needs, not just treatment of disease. But because it's such a valuable benefit, it can be abused.
Here are some common hospice fraud red flags. A patient is enrolled in hospice even though they are still receiving effective treatments and are not truly terminally ill. Providers sign patients without the knowledge of the patient or family. Agencies provide less care than what's in the patient's plan, such as cutting weekend visits while still billing Medicare for full services. Hospice billing continues even when the patient doesn't qualify or has already passed away, sometimes with the charges shifted to the patient's estate.
That last point is really important. Sometimes families don't even realize fraud happened until months after their loved one has passed away.
That's why it's so critical to keep your doctor and family involved and to make sure you understand what you are agreeing to when you sign hospice paperwork.
Here are some practical steps you can take. Review your Medicare summary notice for unfamiliar charges. Ask your doctor directly which agency they referred you to, for what services, and why. Never sign paperwork you don't understand. Ask questions first. Involve your family or caregiver, especially if you're homebound.
And remember, fraudulent charges often don't show up right away. They may appear months later. That's why reviewing your statements regularly is so important.
If something doesn't look right, don't ignore it. Call us at 1-877-272-8720 or visit www.stopmedicarefraud.org to learn more and report concerns.
And if you need help understanding your Medicare coverage, connect with your state's SHIP, the Senior Health Insurance Information Program, at www.shiphelp.org. They offer free, unbiased counseling. Gladys's story shows how quickly home health and hospice fraud can happen. Stay alert, ask questions, and protect your Medicare.
Thanks for joining us on this episode of Ask SMP. Remember, you can help fight fraud and protect your Medicare.
Take care, and we'll see you next time on Ask SMP.